Hello and welcome everyone. My name is Vanessa de Coppi and I am presenting my poster on telemedicine benefits and challenges in rural and remote pediatric cardiology. I would like to start off by disclosing that I have no relationships with for-profit or not-for-profit organizations and that this session has not received any financial or in-kind support. Congenital heart disease, or CHD, is characterized by complex care, close monitoring, and significantly compromised quality of life. For critical or major conditions, which are the most common, immediate treatment upon diagnosis is necessary for survival. The problem is that not all children and infants with CHD are impacted equally. Northern, rural, and remote communities are characterized by limited access to healthcare services and cardiovascular specialists and greater exposure to environmental hazards. In fact, less than 2% of Canadian specialists practice in rural areas, despite 18% of the population living in rural areas. While there are 15 CHD centers across Canada, they are largely based in urban areas, which means that patients in rural and remote areas must travel long distances to receive the care that they need. The result is that these infants and children experience inferior health outcomes, delayed diagnosis and treatment, financial and social strain, and unnecessary transportation. Telemedicine offers a potential solution to this problem. In practice, telecardiology, which is the use of telemedicine in cardiology care, can involve a patient visiting a local primary care center where they will be connected with a cardiologist at a distant site via telemedicine. Or, alternatively, a patient can be directly connected with a cardiologist using telemedicine from within their own home. The literature reports numerous benefits and drawbacks of the broad application of telemedicine. However, in Canada, and especially in rural and remote communities, telemedicine services are not sufficiently established with no widely accepted frameworks currently available in the literature, especially for this particularly vulnerable patient population. This literature review aims to better understand the effectiveness of telemedicine and pediatric cardiology practice, inform health policy, and contribute to the development of a telemedicine framework. The integrative review methodology put forth by Whitmore and Naffel in 2005 was applied in this study, and the theory of access by Penchansky and Thomas in 1981 served as the theoretical framework. My search of the literature yielded 35 articles that met inclusion criteria. While only 4 studies came from Canada, all studies focused on a rural or remote population. Data was organized based on 6 key data abstraction questions, which fell under the following 6 key areas in the top right here of the poster. Across the literature, various types of technologies were used in pediatric telecardiology, including virtual consultations and remote monitoring devices, such as teleechocardiogram, pulse oximetry devices, and more. These technologies showed high diagnostic accuracy, sensitivity, and specificity, with few technological issues. In terms of patient and caregiver experiences, high to very high satisfaction and comfortability with the quality of care was consistently reported, with few significant technological issues. Caregivers reported significantly enhanced access to specialist care, along with improved continuity of care, which is often a challenge for those in rural and remote areas. However, there was reluctance towards virtual care completely replacing in-person care, with a preference for the two to complement each other. Healthcare providers widely reported that telemedicine was useful, good value for money, that it had high diagnostic accuracy, and that it allowed for more efficient clinical decision-making. Costs were widely discussed across the literature, with 3 key themes being initial and ongoing telemedicine program costs, patient and caregiver costs, and healthcare system and physician compensation. The benefits and barriers of implementing telemedicine were widely acknowledged, with the most predominant benefit being improved access to care and reduced transfers to tertiary care centers, and the most significant barrier being high setup costs and physician licensure and credentialing issues. Overall, this research demonstrated that when used among a rural and remote pediatric cardiology patient population, telemedicine improves the availability of necessary healthcare resources, leads to long-term savings for both the patient and the healthcare system, reduces geographical and financial barriers to care, and meets the needs of patients and caregivers. Future research and policies must tackle issues related to the rural-urban digital divide, inconsistent policy, licensure, and funding requirements for telemedicine services across Canada, and appropriate contextual and cultural training for urban specialists providing virtual care to rural and remote patients, especially those who are in Indigenous communities. Thank you.